Cicela
things they
India
happen.
Media.
The boys and girls for the WhatsApp group say they want information about this particular topic because it bust them mind. They know they understand what is happening. They don't know whether right now made them use them mouth, made them use them hand, made them use them tongue. They don't know what make them use the kind of weapon them for take do the thing because right now, no, if you go use the wrong weapon, it will bring wrong things to your life inside. So we publish an article on our page, and this is the title: Oral sex is now the leading risk factor for throat cancer. Oral sex is now the leading risk factor for throat cancer. Now, this has been published on several media platforms. And so, as we publish and we go viral in the comment section, people are saying, they concern them. People are also worried. There are people in the comment section where they drop, There's this, boys take them off, go enter some place. So, on this episode, I have, Dr. Greg in the studio with me. We are going to have a conversation about oral sex and why it is linked to why right now it be leading cause of throat cancer in the system. So, Doc, welcome.
Thank you.
Everything cool?
We there inside.
You take your mouth, go pass on.
Oh, no. I take your mouth, go pass anyway.
Hey, Doc.
Yeah. Unsuru.
Oh, yeah, sure.
Unsuru.
But anyway, Doc, oral sex is not the leading risk factor to throat cancer. How true, is this?
Yeah, it's true.
It's true.
Yeah, it's true.
Also, what is oral sex?
So, when it comes to sexual activities, we have the natural way of having sex.
What is the natural way?
So, that's the male penis entering into the female vagina.
Wow.
That should be...
This is a discovery.
Yeah, that should be the natural ways of having sex. But other forms, like a man putting the penis into the mouth of a woman, popularly known as blowjob.
Gok.
Yeah, or BJ.
How do you know? I read.
He's a researcher.
Good. You think I'll come and sit here and don't annoy me?
Then a man to put in his mouth on a woman's female part, that's into the vagina. Yeah. People also call
I
it.
hear some people they do the anus or anything.
Yeah. People to do that one. Yeah. So doing these things, there is something that actually causes this throat cancer. The reason is that there is a virus known as human papilloma virus.
Okay.
aka HPV.
Okay.
So this HPV is what is increasing the risk of the throat cancer. So when it comes to HPV, we have about 200 different strains or variants. So we have the low risk and the high risk. So the low risk, we have the HPV6, we have the 11, we have 40, 41, and the rest. They normally cause the genital warts. So people have warts, but that one is even low.
Okay.
That's low risk. Then the high risk, we have the HPV 16 and the 18. That causes mostly cervical cancer.
I see.
It increases the risk for cervical cancer. Then the HPV 16 is what causes or increases the risk for the throat cancer.
Okay.
So it's one of the high risk. So when someone engages in oral sex, assuming a man engaging in oral sex with a woman, if the woman is having an HPV infection, maybe she's having HPV 16 and 18.
Down there.
Because it also causes cervical cancer. And as you're having this conversation, you're in January, and January is Cervical Cancer Awareness Month.
Oh, beautiful.
So all women, we encourage the women to get screened for this particular virus using their pap smear. So there are some women who have HPV infections without even knowing. So a man engages in oral sex with this woman. The fluids from the woman enters into the oral parts or oral cavity of the man. It affects the orophageal area, so the oral and the pharyngeal sites. So that's the connection between the stomach and the larynx. So we have an area. So that's the truth. So when that happens, the HPV 16 affects that side. So assuming someone who engages in a lot of oral sex, that's even one person. So if you're having multiple sexual partners, it means your risk is even multiplied in the highest numbers. Because if you're having, let's say, 5 women and all of them are having HPV infections without knowing, you, the man, your guess is good as mine. Also, the reverse. A woman engaging in oral sex with a man can have the HPV infection and pass it on to the woman because the HPV infection is transmitted sexually.
Okay.
So it's transmitted during sex. Okay. So if a woman also engages in that.
The oral?
Yes.
But you see, the penis is like a sausage, right?
Yeah.
You see, there is no fluid substance coming from the penis when you are... Why am I explaining this thing? God? There is no, fluid coming from, let's say, the penis when you are doing the go-go, right?
It depends.
Unless the person come in your mouth.
So we have what is called pre-cum before the ejaculate.
Okay.
So there are fluids that will come out before even the ejaculate, that is the spermatozoa, the semen comes out. Some people will come during the process. So you can't just say that there is no fluid that comes out. So this will tell you that the risk will now be more of the men.
Okay.
than the women, even though everyone is at risk of having the throat cancer. But when you read further, you see that there are a lot of men who are engaging in oral sex who get this. And also people who even engage in anal sex also get these things. But today you're talking about the throat cancer. So when you engage in this oral sex, the fluids will transmit the HPV infection to you. Ideally, the HPV infection is supposed to clear out of your system within some months, depending on your immune system.
Okay.
So if your immune system is also weak, it means your risk is even going up. There are other factors that will also contribute to this.
Okay.
Assuming someone who is a smoker, smoking will increase your risk for several cancers, including lung cancer and the rest. And smoking will bring down your immune system. If this happens and this person is also engaging in oral sex, your guess is good as mine.
Wow.
The person will have the high chance of having throat cancer.
What if I put polythene bag in my mouth before I do it? Or there is some mouth condom or something?
There is something known as the dental dam. Yeah. So it's like a dam. So you know how a dam is. A dam is supposed to collect water.
Dam.
So it's like a dam. So
what about dam?
So that one is supposed to be used, but not a lot of people even know about it. That's one. And its availability.
Wait, it did a pharmacy?
It did some pharmacies, but it's not common like that.
Okay.
And as you know, people always say that they want it raw than COVID.
They want it what?
Raw than COVID. We are in a generation people are afraid of pregnancy more than STI. Yes. Every practitioner will let you know.
We people are more afraid of pregnancy than STIs.
How many ladies will go and have sex and later go and test for HIV?
Nobody will test.
But after sex, most of them will go for these contraceptives, right? So far as they are not pregnant.
So they are saying that STI is greater than unwanted baby.
That's the mathematics.
That's the mathematics of the thinking.
Now, yes.
Them. The youth.
As you are doing that, your risk of having these STIs are also increased. So that's why you are saying that this oral sex now is a leading cause of the throat cancer. It's because of the HPV virus that people get infected with. And without knowing. And it's also a silent virus.
Okay.
So when you get this HPV virus, it won't manifest at the early stages. It can be there for a long time. If your immune system is strong, it will be proliferating. And as you're engaging in that activity for a long time, it means your concentrations are also increasing.
Okay.
Someone who has, let's say, 5 boyfriends, 7 girlfriends, 10 girlfriends, everybody wants head. So you can just imagine.
Miami.
So you can just imagine how this virus is being spread. And the one who is also giving someone said, let's say someone is having an HPV infection and the person goes to engage in oral sex with another person who is not having. It means the saliva that's coming from the person is going into the other person. It means you have another candidate who has been infected. It goes that way.
But dog, you see, make we do some semantics more. Right now, they say it's a leading cause.
Yeah.
What do you think they contribute to that? Because probably they ain't no be leading cause, but all of a sudden, I'm sure a lot of things contribute to people getting throat cancer and everything. But right now, oral sex, they want the the tafribomski, it be the leading cause right now. Why? What is the problem?
It's because now people patronize or fancy that sexual activity more than the other forms of sexual activity.
Traditional form.
Or people have come to add that to the traditional way of having sex. So it means a lot of people are engaging in oral sex now. So it means a lot of people are going to get infected. And a lot of people who are having HIV infection without also knowing.
Okay.
Because people don't even go to the hospital to check themselves out. Most people are sexually active.
How often you for check?
So if you are a sexually active female,
who is a sexually active person?
Anyone who engages in sexual activity consistently, which means you're a sexually active person.
You know, the matter whether it be multiple or it be one person.
So far as you are engaging in sexual activities, means you are a sexually active individual.
Okay.
So we always say females who are sexually active from the age most now even as low as 12 years.
Well, yes, we are not encouraging that.
Yes. But as low as even 12 years, people are engaging in sex. So when you know that you're a sexually active individual, you have to be checking yourself at least every 3 months.
Every 3 months.
Okay. If you're a woman, if you're not so old and you are within the age of, let's say, 12 to 26, 30, we encourage you to be doing your pap smear to check if you have HPV infections and other infections, because you don't know when you're going to get or when you had an infection.
Okay.
Yeah. If you're a man too, we encourage you to do that, to also get yourself screened. If you also are someone who changes sexual partners, if you know you have a sexual partner, make sure that you get tested and know each other's status.
Okay.
Before you engage in any sex or any activity that you want to engage in, so that you know that this one is not from this person. I always tell people that if you're a couple or you're in a relationship and you are far from each other,
okay,
no one knows what each other is doing anyway.
Okay, long distance.
Yes. So for safety of each other, make sure that at least anytime you come together, make sure you run tests on yourselves and know the true state of each other before you engage in.
But everybody does say you don't trust me, and you trust issues.
And so be HIV, I say good name.
Yeah.
If I'm having malaria, it's not written on my face.
True.
That's how it is. You can't use trust to diagnose conditions.
You
can't use trust to diagnose medical conditions. No. So we don't base on trust. In that
test.
Yes. That one, it saves each other. Or you have to protect yourself.
Okay.
So the use of condoms is encouraged.
Condom, which we are trusting.
At least it's a barrier method that gives you some kind of protection. That one, if you know, some people, they change their girlfriends like they're changing their boxer shorts. So someone
today
like that,
you came for people.
Oh. I know the boys in the comment section.
Don't worry, they will be fine. You're bad boys.
Oh, yeah, so you have to protect yourself as an individual. Yeah.
Okay.
Because when you begin to get cancers, it's difficult to manage it. The cost involved, the financial burden, the emotional constraints that it comes to you, your family, everybody. And this throat cancer, what people don't know, when it starts like a sore throat.
Okay.
So sore throat, persistent sore throat for a very long time. So mostly about, let's say, 2 weeks. So maybe you had a sore throat, you try treating it, it comes again.
Okay.
When that happens, it raises an eyebrow.
Okay.
Also, people have even visible ulcers in their throat.
As in the crew.
Yeah. Hey. That fails to heal. And also another one. Some people, they even have, some people, yes, affect their ears.
Hey.
Yes. So they'll be having ear pain, thinking it's an ear infection. Because the nose, the throat, and the ear, they are linked. That's why you call them ENT. So you can have an infection in the nose, which will transfer to the ear. Yeah.
Okay.
So it's a myriad of conditions. And if care is not taken, mostly the diagnosis is missed.
Okay.
Because everybody's, wait, they say sore throat. Oh, go and take these medications.
When you're cold,
sometimes you don't even have cold, but you're having
sore throat.
And when COVID came, now
it was worse.
Now people are having sore throat. So the diagnosis becomes broad. By the time we pinpoint that, this person is having a throat cancer, it might have advanced to the late stages.
But you go treat them, you go come out them for the throat inside.
So it depends on the stage you've got into, the prognosis, and also you, the individual. So the treatment options, surgery is part. But when it comes to cancer, you do surgery plus other stuff. Chemo is another option. So it's something that mostly is missed.
Okay.
Mostly is missed because of the way it presents itself. It's like someone having colon cancer or abdominal cancer. Most people who practically have seen, or people who have seen in practice, who had colon cancer, they came with ulcers, like, every time I say my ulcer, stomach ulcer, like that. By the time we realized that the person was having a stomach cancer or a colon cancer, it was advanced. And that time, most of the time,
what caused the delay though? Because
so that's, you see, we have
because on the first try, you should be able to
differential diagnosis.
Okay.
So when you come and present, it brings about a lot of conditions. Assuming you come to me with sore throat, the first thing will not be throat cancer.
Okay.
So that's how diagnosis works. There are a lot of conditions that mimic that. So you have to be doing tests to rule out.
By the time I will draw on.
Too late.
But who discover and say, okay, throat cancer, yeah, you go if you treat them, then everything. Yeah. Is it expensive?
It's expensive. That's another thing.
Expensive.
It's expensive.
Into vitamin C, into mean cure.
Cancer, vitamin C doesn't cure vitamin A cancer. Vitamin C doesn't cure cancer.
Fruit cancer, vitamin C.
Actually, there be vitamin.
Why you really laugh?
Ginger or not?
Ginger, like
there be.
It's me.
So cancer with cancer, we have things we call tumor suppressor agents. When you have these HPV infections, they produce certain agents that suppress the tumor suppressor agents. And the genes now suppress cancer growth. Those things have silenced those ones. So it means the cells will be overgrowing. It means they are in the cancerous state. And then ginger and immune stopping.
Wow.
Because the DNA changes, mutations, and all of the stuff that have occurred is not ginger.
Okay. But so doc, right now, no. So it means protect yourself, right? Yeah. So anyone could just walk to pharmacy and tell them say they won't buy, because more boys go do them. Because based on the comments, our sentiment analysis, it doesn't look like boys they won't stop. The girls too they won't stop. So right now, where we did right now, where it be leading cause of throat cancer, where the boys and girls no won't stop. walk me through what, like, some of the things we will do at least to protect one our body, at least to make sure that even if we
Okay.
what can we do?
So we have what is called screening.
Okay.
That's the first thing. Mostly this one goes mostly to the women.
The women, okay.
Make sure that you get screened for HPV. If you are not having an active HPV infection, we have a vaccine that we give out.
What do you mean by that?
So there's a vaccine. So let's say if you're not infected right now, because if you're infected, giving the vaccine is another whole thing.
Okay.
So if you're not infected, we have vaccines that we give to you, the individual, that protect you from the HPV.
Okay. Oh, okay.
Yeah. So we have those vaccines which cover some of the low risk and the high risk, including the HPV 16.
Okay.
We normally give that vaccine to protect women from HPV that causes cervical cancer. So it's something that we always encourage every woman. If you are in between 12 to 26, sexually active individual, we advise you that try and get that vaccine. But before you do that, you have to see your doctor, do the screens before it's recommended for you.
Okay.
Yeah, that's one thing that I'll always tell the woman, that make sure that you get that vaccine shot. Also, if you are someone who cannot abstain from sex, please protect yourself.
Okay.
Especially if you do run-ins. And right now, the dangerous thing is that a lot of people are into hookups. Now there's hookup almost everywhere.
True.
Yes. So someone will not go and pick someone from the roadside, but they have their ways of
WhatsApp group near that. What do you show me?
So assuming you've picked a hookup lady, right? And the person has been with someone who has an HPV infection, only time
yeah.
So such a person, if you know you are into such activities, protect yourself.
Okay.
That's one thing. Then also make sure that you get screened. As I said, that's one thing that you should take good care of. Get screened and protect yourself. Use condoms.
Okay.
If you know you cannot abstain, use condoms. That's one thing I always tell people. So that
what be the name of the mouth thing?
It's called dental dam.
Dental
dam.
Oh, I'm asking for the boys. Wait, boy, how?
Dental dam.
Okay. Unim ho pharmacy's number.
They should meet me in the comment section.
Okay. Dog say for follow up for Instagram or the comment section. He now go reply. Okay.
Yeah. So that's also another way of getting infected.
Okay.
So female to female, people are using dildos. You can also get infections from there. Okay. But the HPV infection is sexually transmitted. Okay. That's one thing that we have to establish. Yeah, most people get it through sexual contact. Yeah.
Okay. So, ladies and gentlemen, this one, the beautiful conversation, simple and short. The solution they there. What you for do, then what you for not do. The ukoyene is book. Bias, protect yourselves and everything. I know people make like jokes about some of these things, like, but it be scary. Throat cancer, and as he said, is expensive to treat. Where it will destroy your life, because bro, and where we define one ourselves, we do we have cancer treatment facilities in this country?
We have, but there are few, and the few too, they are expensive.
Wow. What's you?
The oncology space actually is one of the most expensive area because cancer care that's
expensive.
So that's the space I am. So
okay.
I see cancer patients almost every day,
and it's expensive.
It's expensive. Very expensive. Even the subsidized ones are expensive. Yeah.
God damn it. Dialysis, as you said, dialysis the and now dialysis have no discount.
Dialysis is less expensive than that.
Than cancer treatment.
So as we have, let's say, one treatment session costing over 50,000 Ghana cedi, and you have to do this every 3 weeks.
Oh, Charlie. Let me obituary.
Or even let's say every 3 weeks you're paying, let's say, 5,000 for a cancer treatment. Which sometimes we will tell you that okay, this treatment you are doing won't kill you, but we'll just buy some time
for you.
You can just imagine.
Guys, assembly new. As you do the comment section, they misbehave. We just know that we need to like arm ourselves with information and know that at the end of the day, it will be welcome.
And also one last thing that we have to add.
Okay.
People who engage in these things who are also into sedentary lifestyles and other lifestyles, like alcoholics, smoking, these things would just bring down your immune system. So if you are in, let's say you are someone who takes shisha and
balloon,
a lot of stuff which are affecting your immune system.
One has our immune system already.
Exactly. Okay. And you are getting a viral infection. So you can just imagine how it will just spread.
Zinc no be solve.
But zinc.
No, the zinc, the vitamin C.
Now vitamin C into me and now zinc.
God damn it. Into now Okay, then they take care of yourselves, guys. Because yes, and as you be leading it means he lead you are. So guys, let's take care of ourselves. Doc, your last words and your social media handles.
Okay, so my last words to everyone there: practice safe sex and make sure that you protect yourself.
Okay.
Throat cancer is real.
Okay.
And to the ladies who are watching me, we are in January. Make sure that you get yourself checked for cervical cancer.
Who they do the checkups?
So when you get to the hospital, you have what's called pap smear. You get to the public health department. Yeah, that thing is done.
The man or woman they do?
Oh, women do it, men do it. It's a professional work. But if you need a woman, maybe some people, maybe religious issues and other stuff, yeah, that one you can do it. And also, I'm doing a series on cervical cancer on my social media. So people who don't know much about cervical cancer, they can be watching and be learning.
What about scrotal cancer?
That's also there.
And also
we have a lot of, we even have head and neck cancers. Yeah.
The head
and neck cancers.
So what will happen to you?
So that one, maybe you have a tumor in the brain, a whole lot of stuff. We have cancer can occur anywhere in the body.
Actually. Why? But anyway, once again, take care of yourselves and your social media handles.
So I have connect with Dr. Greg on Instagram, Facebook, TikTok, X, YouTube. So you can follow me there.
All right.
For more health content.
Yeah. And you actually they do them health content. So nobody say yes, they talk and be like every day they drop video. You don't want to give you people information, but if people know they won't watch and by force, yeah, they better.
I was saying, yeah, this show.
Press that. Twitter that video need them because boys in TSM. We come through comment section. One more be say use me as a hey. What's the deal? I'm okay.
So you can imagine. So me as a practitioner right now, I'm imagining 5 years, 10 years down the line, how it's going to happen.
You're very fine.